Welcome to Beauty Times Medicine, our video series hosted by Galderma, where we'll uncover the science behind beautiful, healthy skin. Joining us today on Beauty Times Medicine is Christoph Martschin, an expert in aesthetic dermatology based in cool and beautiful Lisbon, Portugal. Dr. Martschin is a member of the Galderma Aesthetic Injector Network faculty and also trained at Karolinska University Hospital in Stockholm. He brings a unique perspective to aesthetic dermatology and really a deep understanding of skin health. Christoph, welcome.
Thank you so much, Dr. Ørnskov.
To start, we ask all our guests, what made you choose dermatology? And specifically, also going into the aesthetic part.
I was, as a teenager, like many people, affected by acne. And moderate acne, but still it posed a significant burden on my emotional well-being. Luckily, I found a dermatologist who, with empathy, compassion, and knowledge, cured my skin, treated my acne, and with that gave me back my confidence and my quality of life. That really was a key moment when I decided I want to become that dermatologist for my future patients. Now, later, working at the hospital, I was often facing a boundary when treating a skin condition holistically.
This is in Austria, or this is in
This is in Sweden, later on.
Okay, later in
An
Sweden.
excellent hospital that gave an amazing education, but it also made me realize that skin is more than either having a disease or being free from a disease. And two examples are acne and rosacea. I could treat my patients' acne, but not the scars. I could treat the lesions of the rosacea, but not the broken vessels on the cheeks. And for many patients, it was the scars or the vessels that posed a much greater burden that stigmatized
They came to you with acne or rosacea, and you said,
I could treat one part, but not the other, because one thing was therapeutic or considered therapeutic, and the other part was considered cosmetic.
But did they have at Karolinska, could you be learning about aesthetics, or did you have to figure that out?
No, I went to the US and I went to Germany, and I widened my knowledge to be able to offer my patients a complete range of services.
And after that, you left acne and rosacea behind, or is that still part of?
No, after that, I switched into private practice, so I became my own boss. And I really decided that I want to treat every patient's skin holistically from a 360-degree approach. Because patients naturally expect us dermatologists to be the authority for skin. Despite all the competition from internet, we still have the trust of our patients to be the preferred source of information. So when they come to me, they want me to look beyond the disease. They want to know how to cleanse the skin, how to moisturize together with...
But do they come to you because you are known to be a classical dermatologist, or do they come because they now know, oh, he also knows a lot about aesthetic medicine?
I think the primary reason for my patients to come to me are signs of aging, because, as you say, I specialized in aesthetic medicine very early on. But in fact, even patients that show signs of aging may have a skin condition additionally. And then, of course, I treat the two together. Or they may have a daughter or son who's affected by a skin condition, and they ask me, Christoph, you take so good care of my skin. Could you help my son, my daughter with their problem as well? And of course, I offer that gladly.
So the age range of your patients must be pretty broad in that situation, though.
That's interesting you're saying it. So I have one family where I treat the grandchildren in the teenage, all the way up to the grandmother in her early 90s. So in that sense, I'm a dermatologist, but also a family doctor.
And you treat them for their dermatological conditions, and if they need...
And aesthetic conditions. I always say dermatology is like a pyramid, helping them to pick a good daily skincare. That's the basis, to take care of your skin, take care of your skin barrier, so skin can do its job. And then at some point in life, most of us will be affected by skin condition. Then I help with the prescription that I can give. And many of us will choose to have aesthetic intervention for self-confidence, for quality of life. And then I offer that as well.
And you're known to really know aesthetic medicine well. So I'm sure you know all the new treatments coming out. But how do you look at a new treatment and say, this is something I'm going to try out, or this may be something I can apply to my patients? How do you make that choice, so to speak?
I'm very curious, and I love innovation. But I'm also cautious because aesthetic medicine is something we choose. It's not something we need to survive. So my standards are very high. The products need to be proven both from a safety and an efficacy perspective. But personally, also want them to be equally performing or better performing than existing options. Then I gladly adopt them into my practice.
So you study carefully what are the safety data.
And this is where I've come to appreciate the partnership with Galderma. Because Galderma, since its start in the 1980s, shared this passion for innovation, science, and maintained a very high standard when it comes to efficacy and safety. So this is a product that I with good conscience.
Is it also how you choose, I want to be involved in this innovation or I want to be involved in that? Or how do you, or do people come to you because of your expertise? Or do you say, hey, I really think that this part of aesthetic medicine is of big interest to me, so I need to be involved in innovation? How does that partnership come about?
I think once you're really passionate about something, people will hear about you. And then they will partner up with you. They'll say, okay, apparently we have the same interest, we have the same passion, let's do something together. Let's see what we can do to involve this business to bring out the next innovation.
And you mentioned you had this family, I imagine, in Portugal, where the age range from the youngest member to the oldest was pretty high. So has there been some trends recently? Are there more young patients coming for aesthetic treatment? Are there more in the advanced age groups? What do you see there?
Clearly, I see that younger patients are better informed. They are constantly exposed to aesthetic medicine on social media. So when they come to me, they've heard about treatments, they've read about treatments. So I think they have high expectations on my level of knowledge and skills when it comes to new treatments, to trends. And they're always happy to discuss. But in the end, I feel most of them trust my advice when I guide them through helping navigate through all the options.
Do they come and say, hey, I've heard about this thing, I would really like to try that out? Or do they ask you, hey, what's new? What should we try out? How does it work?
In fact, many of them come with a bag full of skincare products and the discussion starts, Christoph, have a look at my skincare routine. What should I keep? What should I replace? So we're starting with that many times. And then I say, okay, what more can I do? What is meaningful for me at my point in time? Because one trend that I clearly see is sustainability. Not only meaning that they question, how does my choice affect the environment, affect society as a wider range, but also what is absolutely necessary? Do you need this ingredient? Do you need this product? So young generation of skin patients, they have very high standards when it comes to this.
They want to know about the ingredients and all.
Yes.
But when you have an aesthetic patient that is maybe relatively new, do you lay out a longer plan for them, or is it a little bit more sporadic? But you say, well, if you start with this, this is what you would need to do, or how do you manage that?
Every patient journey starts with a holistic assessment of the face, of the skin, where we're mapping out the needs and the wants. And then from there, we take the discussion where the patient wants to start, at what pace and how ambitious they are. So I think this is something that's highly individualized and personalized.
And in some parts of the world, we're seeing a rapid penetration of products that help patients rapidly lose weight. Does that also have some spillover to the aesthetics field? Because, of course, your face may change.
Absolutely.
What do you see there?
We know that the loss of facial volume is one of the hallmarks of facial aging. So if you undergo rapid volume loss, of course, this will change your face. And luckily and interestingly, there is data suggesting that polylactic acid, like Sculptra, has a protective effect on the facial fat cells that maintain the structure of the skin. So I think there's great potential in helping patients both achieve the weight loss that they want, but maintain the face that they're used to.
So if you look ahead with all your expertise, traveling the world, being involved in a lot of clinical trials, what excites you the most on the horizon in aesthetic medicine?
That really excites me is that I feel that with every year that goes, more and more people really take care of their skin from a holistic perspective. I remember my generation, we would go to the beach without even sun protection, and they would say, okay, I can do something about it 10 years later. So I really love that, that conscious, that awareness that patients have today, that they know I have one skin, this is my barrier to the world, and I take best care of it. So I think this is really something that enables me to help them at every stage of life to have their best skin.
Very fascinating. Well, Dr. Martschin, thank you so much for sharing all of your great insights today. And like you, we look forward to what's next in this exciting field. So we look forward to bringing you more leading voices and expert insights from the world of dermatology. Be sure to follow us on our social channels and stay tuned for more.